guest speaker today is representing the Health Science Career Cluster. People in these careers use medical knowledge and skills. They check both health and patients with correct problems. Some carry out treatments, therapies, and tests. Please welcome Jenny Ball, Physical Therapy Assistant, Mr. Ball's Physical Therapy.
Hi everybody, I'm Jenny, and I want to talk to you about physical therapy today, and I don't like talking in front of a microphone, so we're just going to get that straight right now. So I'm going to try to answer all you guys' questions. I've been a physical therapist assistant for 16 years, and I go into people's homes. So what I do is when they come out of the hospital, they get a prescription from their doctor, and then they'll call our home health agency, and then they will ask me to come in after the physical therapist because I assist them. They come in and do the primary care, and they do the evaluation. That takes about an hour for each patient. And then they will come to me and they will tell me what exercises, what the diagnosis is. We see patients with hip transplants, we do hip replacements, knee replacements, shoulder replacements. I see babies from 3 months. My oldest patient at one time was 103 years old. So we cover all of the ranges. We actually see patients in the school districts in a few of the counties. I contract through about 12 different home health agencies. We cover all of southeastern Ohio. So I don't only work in Jackson County, I work in Athens County, Gallipolis, Meigs County occasionally. And so we stay pretty busy. I see usually 10 to 14 patients a day depending on where they live at. So I drive from patient to patient. So what happens is I'll go into a patient's house and they'll sit down and I'll ask them how they're feeling. To be a physical therapist assistant, you need to like people. You need to be nice to people. You need to be respectful to people. Everybody has their own ailments. Some people you'll walk in and they'll say they're doing just fine. And other patients you'll walk in and they're really having a lot of pain, they're having a lot of struggle. And a lot of people don't like to exercise. How many of you do not like to exercise? Okay, well when you're 80, 90 years old, that is not their favorite thing to do is exercise. So you have to be nice to them. You have to go in and talk to them about their families, ask them how their day is, talk to them about their pets, the weather. You have to be personable like you guys are with your friends. You find friends you get along with, you guys talk about your day. Well, that's what I do. Every household that I go in is different. Every patient is different. So I go in and I have this form, and it's front and back, and you have to do a progress note on every patient you see. So like teachers do grade papers, I have to go home, and Connor says this is my homework every day, is I have to go home or do it at the patient's house and do front and back of every patient. So I go in and I assess them every visit. So I take their blood pressure, I take their, these are called vital signs, so I take their blood pressure, I take their pulse, I take their respirations, their heart rate, their temperature every visit. And if it's above a certain level, I have to call their doctor to let them know, or I have to tell them to go to the emergency room. So after I do that and they're all clear, then I ask them, well, how are you feeling? What's your pain level? 0 to 10. If they say it's a 10, then I tell them I'm going to send them to the hospital. So I don't have very many that ever say it's a 10. So after that, then we start exercising. So what physical therapy does is I can do any exercises. I can work from your head all the way down to your feet. We work on upper extremities, which is your arms. We work on lower extremities, your legs. We work on balance, coordination. And so we do all kinds of exercises to help these patients get stronger. So, and then we work on like transfer training. Some people are in a wheelchair and they can't stand. So I have to go in and I work on sit to stand exercises. We work on bed exercises where we roll them side to side. I have a few patients that's been bedridden for a couple years. So for them to sit on the side of the bed is a big deal. So we have to teach them how to roll over, sit up on the side of the bed. And then most people, you'll keep them on the side of the bed just for a couple minutes because their blood pressure will drop. So these are things that you have to monitor and watch their facial expressions to see if patients are in pain. Because some people don't want to hurt my feelings and they don't want to tell me I'm putting them in pain. So you have to be aware of your surroundings and you have to be aware of how they're acting. So, and a lot of patients we walk with home health, I can walk people outside. I walk people all over Jackson County every day. So that's the difference between home health and hospitals, is most of the time you don't really get to walk people outside. And so we walk outside, we'll do exercises outside. I was doing a patient the other day, and Mr. Groff went driving by, and a patient was doing standing exercises on his porch. So I try to make it fun, and the patients that don't get to go outside, I try to take them outside when I go to see them. So, and with homebound patients, they are, most of them can't drive, most of them can't get out, so that's why they get therapy at home. Now, you can go to outpatient therapy, and what that is you'll get a doctor's order, and then you'll find like Holzer's, Adina, Periphysical Therapy, places like that. You can actually go to their facility and see them. And so you'll just go there, and they have more like gym equipment and things like that. Whereas with home health, I don't have that equipment. I can't carry it around with me. So I brought some things for you guys to look at. Like I use this, I didn't know I was going to be talking on the microphone, it's kind of hard to show you, but I use this with almost every patient for their arms. So what we'll do is like you just pull it in and out. And we do about 4 or 5 different exercises. This is did you find out if anybody's allergic to latex?
Anybody in here allergic to latex?
Balloons, anybody allergic to balloons?
Latex?
Nope, okay. We're going to pass these around, and if you look at them, they have different strengths. So we'll start out with level 1, depending on their strength level, how much they can lift and things. And then this one is a size 5. So this is one of our stronger ones. I don't have very many 80, 90-year-olds that can do level 5, but my younger patients and stronger ones can use them. So when you get it around to you, pull on them and see how strong they are. Unless you're allergic to balloons, and then don't touch them. So that's what we do a lot with the arms and the shoulders. We do a lot of shoulder replacement patients. So we do different exercises for different diseases that people have. We have patients that has muscular dystrophy. So it's kind of like a deterioration. So as they start deteriorating, you go in and you help strengthen them so they can stay functionable. So just do a few and then pass them down so it gets around to everybody. So we'll get back to some of your questions here in a few minutes. So I'm going to look at my notes and let you guys know what we're doing. So we already talked that, my job activities is just to assess the patients when I go in. I write their notes down. We work on transfer training. We work on gait training, gait patterns, and that's you walking. So if you're walking in front of me, I assess how you're walking. So it doesn't matter if you're 2 years old or 100-year-old. Every time I see someone, I'm assessing them in my brain and wanting to fix or help them correct how they're walking. So, and there's so many different details with our ambulation. And then we do, like I said, we do a lot of exercises with everybody. So to become a physical therapist assistant, I went to Hocking College. I went 2 years. Now, to be an actual therapist, it's like 6 to 8 years now. I think you have to have your master's degree to get your physical therapist. The only difference between me and a physical therapist is that I can't do the evaluations, and then every 30 days you get, in home health, you get an assessment done by the physical therapist, and I can't do that. Other than that, I do everything that the physical therapist does. So after you get done with college and you go through your 2 years, then you go take a state's boards test. Now when I went 16 years ago, I had never looked at a computer. We didn't work on computers, so I sat in front of a monitor for 3 hours taking my state boards test. And it took about 3 hours to get it done. You do a lot of studying with that. And then every year to follow up, every 2 years I have to have a continuing education class. So usually I have to take 2 classes to keep my license going. Every 2 years I have to take that class. And then I think it's every 2 years I have to renew my license. And I take CPR, you have to have CPR. I get like TB shots, the hepatitis shots. So we have to keep all of that up so we can see patients so they stay safe and so I stay safe. And then the yearly openings, it varies. We haven't hired anybody for a really long time, and then we've hired 3 therapists in the last couple months. So it just depends on how many patients we have and what is needed in that area and the different coverage. So for the hospitals, I think they probably have like probably 2 to 5 new therapists every year, therapist assistants. Work experience, I come right out of college. I went to 3 interviews, I got all 3 jobs. So when I first got out of college, I worked 3 jobs, which was super fun. I worked in I did what I do now, which is home health. I worked at Holzer's PRN, which just means when they needed me or holidays, I went in, and I worked at a nursing home. And I really enjoy the home health, so that's where I'm at. The average salary is anywhere from $46,000 to $100,000 a year in the state of Ohio for a PTA. And that'll vary from area to area. I think in this area, it'll probably be between the $45,000 to $100,000, and also depends on your experience. Where I've did it for 16 years, I'll get paid more than what most people would just coming out of college. So, health and science is the major subjects that you guys would have to know for the physical therapy. We'll get to questions in just a few minutes. Health and science, because I had to learn from head to toe every bone, every nerve, every muscle in your body. So you have to, if they send a prescription over and say, well, you need to massage this muscle, then I need to know where that muscle is to massage it. And I don't like to do massages, so I hope I don't get a lot of those orders. But we do give massages too. So stay studying on your health and science, your anatomies, pay attention to that, learn all your muscles and bones if you're definitely going into this career choice or any healthcare choice. My favorite part of my job is the people that I work with. I get to see amazing people, and I love working with the elderly, and it's amazing to walk into someone's house and they can barely walk, and by the time that I'm done with them, we can walk a couple blocks, or we can walk down to the street, or I'll walk people uptown and they can see the different storefronts. So that's the most rewarding part of my job, is knowing that I'm out there making a difference, and that I'm out there helping people change their life so they can get back to their daily routines. I would recommend this career. I love this job. When you become a PTA, there is nowhere you can go. There is no other job that you can go to as a physical therapist assistant. That's where you're at. You stay there. I could go on to school to become a physical therapist. It would take me another 6 to 8 years to do that. So there is no, I can promote, like I could go to a hospital and promote up into the therapy department there and things like that, but there is no one anywhere else. Once you're a physical therapist assistant, that's my job title. That's where I'm at in the healthcare. So we went over the TheraBand, and then a lot of times too, I will put ankle weights on patients, so we'll sit in the chair and we'll do some ankle weights. And then this is called a goniometer, and I use this a lot for my knee replacements, shoulder replacements, hip replacements. So when they come out of the hospital, we will measure their knee to see how far they can bend and how far they can extend. And we need to get that from 0 to 120 degrees, is for you to be able to functionally get everything back in working order for your knee. So most of the time I'll get patients and they're stuck at 10 degrees. So their knee will be bent up here 10 degrees, and so I have to get that straight. So we work on different exercises to get their knees straightened out, and when they bend, we need 120 degrees. And to get them to be able to go up and down steps, they have to be at 80 degrees before they can functionally go up and down steps. So this little thing tells me what degree they're at, so I know how much harder I need to push them. And sometimes I do have to push on their legs to get them to go where they need to, and they don't really like that, but we have to do that so they don't have to go back in and have surgery again. So that's a goniometer, and we'll pass it around and you guys can kind of look at that. And I'm going to pass a couple of these notes around, and you guys can kind of look at those of what a progress note looks like. That's what these notes are. And every company is different, but this is what I have to fill out for each patient every day. So I guess it's my homework. But if I don't do that, I get in trouble by the state and I don't get paid. And I like getting a paycheck every week. So some patients, I just used this machine on my last patient. It is called an ultrasound machine. So you plug it into the wall, and I didn't see an outlet up here, so I can't turn it on. But anyways, oh, is there one down there? Well, there we go. I was looking up. So what the ultrasound does is you turn it on, and it's slowly coming on. It doesn't want to work today. But this is an ultrasound head. So what I do is I put lotion on this. If you don't put lotion on it and you don't keep it moving, it'll burn your patient. So you have to, when you go to college, make sure if you go for physical therapy, you put lotion on this and you keep it moving. If I leave it on my arm just like this, it will burn me. So you have to keep it moving. And usually we do about 5 minutes on each patient, but this thing is for pain. So an ultrasound machine is for pain. And it's got a very expensive crystal in the head of this, so you have to be super careful with it. So I'm not passing it around. But it's got a very expensive crystal in there, and it radiates waves down into your muscles, so it helps with pain. My last patient, she said, Jenny, she said, you come and did that last week. She said, and I haven't had any pain since. Now, it doesn't work like that on everybody, but it really helps with the pain. But I usually do it 2 to 3 weeks to whatever area they need it, and we do it for 5 minutes. And there's a watts and centimeter square on there. And so if it's like a bony process, which is like over your knee or over your elbow, we keep that electricity down to a minimum so they can't feel it. And they will never feel this. When I'm doing it, they won't feel it. If it's getting too hot and they can feel it, then it's going to burn them. So you got to be really careful when you're using machines, any machines in any healthcare. You need to know the contraindications for it. And with this machine, it has contraindications, so there's some things that I can't do. We don't get it close to people's spinal cords. We don't use it on patients that have cancer because that's a contraindication of using it, is they don't know if it would bother that, so we just don't take any chances. So what I do is I ask every patient before I use it to make sure that they haven't ever had any cancer or anything like that. So, let's see where we're at now. So does anybody have any questions? Whoa, Jake. Oh, okay. Your turn.
Are your employees drug tested?
Our employees are not drug tested at this time, but it's different, I would say, in the hospitals and nursing homes. They probably do drug test. But I've been at my job for 16 years, so I never had to get one yet.
Do you have any weekends off?
The good thing about my job is when I was picking out for college, I said I want a job where I'm off in the evenings and the weekends, and I am off every evening, every holiday, just like you guys are. So I enjoy that.
What is the best part of your job?
Working with the people. I like working with people. I like helping them get stronger.
Does attendance matter?
Yes, attendance matters. As I spoke before, if I don't see my patients, I don't get paid. If they're sick that day or they're going shopping, I don't get paid. If I'm sick or the kids are sick and I can't go, I don't get paid. So attendance is very important.
How many hours a day do you work?
I usually work 8 to 10 hours. I start really early in the morning, usually about 7:45 I start seeing patients, and then I just go until I get them done. I think I've got like 4 more left today to see. So I can't see like 15, 20 patients a day because I do drive to each individual home, so it's a little bit harder for me to get around. Who else has got questions?
How are you evaluated?
I am evaluated. Usually my boss, he'll just look at my notes because he has to sign off on every one of my notes. We got 2 therapists that works for our company, and one of them will look at my notes. After I turn the notes in, my secretary will type them up, and then we send them through the computer system. We have a very secure computer system because HIPAA is very confidential. I can't tell you patients' names. I can't tell you where they live. I can't tell you, anything like that, any personal information. So, I can't even remember what your question was. Oh, evaluated. So if I don't do my notes and I don't turn them in, then my boss will, he'll call me and say, hey, you need to step up your notes. You need to get them in on time. Or if a patient complains on me, where I'm an early person, some patients don't like early, so sometimes they'll call in the office and say, can you have Jenny come a little bit later? But other than that, I've got a really easy job compared to most. Who else has got a question?
What advice do you have for us?
What advice? Start planning now on what you guys want to do for your future. Now, when you decide to go on to college, make sure it's something that you guys want to do. If you want to go into physical therapy, then I suggest start going in and volunteering, calling me and saying, hey Jenny, do you care if I go around with you a day, just so you can see. Because when I was in college, I did home health as a clinical. So I went for, I think it was 10 weeks, I did home health and I hated it. I was like, I will never do home health. And then that's where I got my job the first thing. So I think you guys going around and actually calling places. And my son, he's a senior, so I've been telling him, hey, call places, get in there, just so you can see. Because my first job that I wanted to do was a teacher. I went and volunteered for a week and I was like, I can't do their job. So I think just job shadowing would be the best advice I could give you guys.
Is attitude important in this career?
Attitude is very important. Even if I'm having a bad day, like before I come here, I had 2 patients and I shut my knee in the door. I don't know how that happened, but it hurts really bad. But I went to my next patient and you know what? We walked those 2 blocks. So it didn't matter if my knee was hurting or not. I had to get up and I had to shake it off. And so you go in there with a positive attitude because a lot of these people don't have family. They come to visit or come to see them. So I'm the only person they have to talk to. So your attitude is very important. You go in there and you're happy and upbeat. And walking up this ramp hurts my knee too, so.
Are the steps at your job for a promotion?
In my job, no. I won't be promoting unless I buy the business or something like that, unless I wanted to start my own business, because as an assistant, I have to work under a physical therapist. So unless I go to school to become a physical therapist, then I will always be under a physical therapist. Who else has got one? Can you guys pass that?
What is your least favorite part of your job?
The least favorite part of my job is driving. Right now I just work in Jackson County, so that covers Wellston, Jackson, and that's about it. Before, a month ago, I was driving 200 to 300 miles a day. Sorry, I got you back down here. She's yelling at me. No, but driving. So I was driving for about 15 and a half years. I was driving 200 to 300 miles a day. So that got a little old.
So if you were to go back to become a physical therapist, would your company help pay for any of that college?
My company, I've never asked them. I doubt if my company would, because my boss is, he's 72 years old and he's a physical therapist and he still goes out and works every day. So I don't think that he would. I've never asked him. But I do know companies in Jackson that they will pay, because there is hardly any physical therapist in this area. A couple of the hospitals are having people come down from Columbus to do their evaluations. So,
The job market is open.
job market is open, yes. And I get job requests every week. I have people wanting to hire me.
Is your company a private company or is it owned by like a hospital?
My company is owned by Mike McGraw. He's the 72-year-old that we was just talking about. He's been in business for about 30 years, I think. And then we subcontract through all the home health agencies. So if these home health agencies start up and they need a physical therapist company, then they'll call us and we go in and work for them. And we contract through about 12 different agencies right now.
How many years has your job place been open?
I think about 30 years. I think he's did it about 30. I've been there 16. I think he was there 15 years before I got there.
Does your company reimburse you on gas money?
I'm considered independent, so for me, they do not. I make more than most do, so that kind of equals it out, and then I do my own taxes. So instead of you working a normal job and then taking the taxes out for you, I have to do all that on my own. So every 4 months, I have to pay the government taxes because I'm independent. But I do get to take off mileage on my taxes. They'll pay you whatever they pay, a few cents for every mile you drive. Some companies will give you a car to drive for home health, but where we contract through all these companies, we can't do that because most of them put like one of the companies is a Hyatt Valley and they give them cars and they'll put their logo on the side of the car. Well, I contract through so many companies, I couldn't put everybody's logo on a car.
How does social media affect your job?
Never post anything bad on social media, no matter what job you get. Do not put anything on social media that you do not want anybody to know about, because that is the first thing that colleges go to. That is the first thing that employers look at. If we're hiring another physical therapist, guess what I do? I go on their Facebook page to see what they've been posting about. If my son comes home and he says, I'm dating this girl, I'm dating that girl, guess what I'm doing? I'm going on Facebook, I'm looking up all this stuff. So you can find out anything about anybody on social media. So once in a while I'll have a patient like friend request me or something, and I'll accept their friend request after I'm done treating them, because most of them end up being family to me. But never post anything on social media that isn't positive or uplifting or a picture of your dog or something like that. But never post anything negative or mean or hateful on social media. Who else? Is that all of them? I'm not answering you either.
You told us that your oldest patient was 103. How old was your youngest patient?
My youngest patient was 3 months old, and they was triplets. So when I went, I couldn't tell you who they were. 2 of them was boys, 1 was a girl. So I knew the girl, and I still remember her name, and I seen her about 15 years ago. So I had triplets at one time, so that was fun, keeping track of triplets. And I seen them for about 6 months. So by the time I got done, they was a little bit delayed where they was premature when they was born. So I just helped them learn how to roll and crawl. I never did get to see them how to walk, because after I worked with them for a few months, they was doing really well. So then they went to outpatient. And that's another thing with home health is I teach and train people to get stronger, and then we recommend the home health, or we recommend the outpatient to where they can go and use machines and things like that.